right, welcome everyone. This is the December 5th, 2024 meeting of the Board of Health for Spokane Regional Health District. Ann, would you please help me with roll call? And for the record, it is 12:36.
Commissioner Josh Kearns.
Here.
Commissioner Amber Waldruff.
Present.
Commissioner Mary Cooney.
Present.
Councilmember Michael Cathcart.
Present.
Board Member Monica Blykowski-May.
Present.
Board Member Patricia Keenholz.
Here.
And Board Member Charlie Duranona will not be present today.
Thank you. Okay, just some house cleaning items. All of our agenda items that are in the packets for the board members that you see on the desk here are available on the SRHD website. Just click on the meetings tab, and then all of the items are there. Under the Board of Health, please only 6 microphones on at a time. They get finicky if we get more than that. And there was 2 items of written comment that is also in our packets as well. That will then bring us to our citizen input. Citizen input is an opportunity for folks in the community to come and speak with us about whatever they would like. It's 3 minutes, and please no cheers or jeers. First up, we will have Caitlin Costanza.
Hello, my name is Caitlin Costanza, and I'm a first-year medical student at the Elson S. Floyd College of Medicine here in Spokane. As a future physician and a direct beneficiary of publicly funded treatment services in Washington State, I am here today to express my strong support for keeping opioid treatment services as a public good and to strongly oppose any efforts to privatize these essential services. While I'm hopeful that we can all agree on the necessity of these services and that access is critical to the health of our community, I'm committed to ensuring that everyone, regardless of their socioeconomic status, has access to the care and resources they need to recover if and when they are ready, and to be able to do so with the care providers that have already earned trust in our community. These services must remain a public resource free from the profit motives that can undermine their effectiveness. If we shift these services to the private sector, there is a real risk that those who need help most will be left without essential support or will at least face increased barriers to care. Privatization is likely to lead to higher costs for patients, exclusion of those without insurance, and a possible narrowing of the scope of care offered. It would undermine the core values of equity, accessibility in our healthcare system. In addition, public services foster collaboration with other community resources, creating a network of support that addresses the full spectrum of challenges faced by individuals in recovery. While this service would still be available in a private setting, I do not trust that for-profit private company would have the same desire to reinvest funds in participants and provide the same benefits to the providers that currently work with this population through this program. As a future physician, I am deeply concerned about any policies that would limit access to essential care for vulnerable populations. We must ensure that people struggling with addiction are not further marginalized, but instead are given the opportunity to heal and reintegrate in society. The only way to do this is by keeping treatment services in the public sector where they can truly be accessible to all, regardless of income or insurance status. In conclusion, I urge this committee to recognize the irreplaceable value of publicly funded opioid treatment services and to listen to the voices of participants who have been providing feedback on this issue for the past several months. Privatization would undermine the progress we have made, limit access to care, and ultimately harm the people that these services are meant to help. We must continue to invest in these services as a public good, ensuring that every member of our community has the opportunity to recover. Thank you for your time and consideration.
Thank you. Susie Saunders.
Good afternoon. My name is Susie Saunders. I am the union representative for Protect 17, which is the union that represents a majority of workers here at SRHD and at Treatment Services. I wanted to remind you again today that since the feasibility study was announced earlier this year, 6 substance use disorder counselors have resigned from SRHD, believing that privatization was a foregone conclusion. That means that hundreds of patients have already been negatively impacted by the decision to even just explore privatization of this vital resource in our community's fight against the opioid crisis. Employees are still worried about what privatization might mean for their patients, their pay and benefits, and their ability to provide for their families. Patients have expressed their fears and worries over what privatization might bring. Some have even been brave enough to share that this process has caused them to have suicidal ideations or consider leaving treatment to go back to using drugs on the streets. Community leaders and partners have also shared their worry about privatization and what a disruption it could cause. Researchers have expressed their concerns about access to important data that they currently receive from SRHD because of its status as a public entity. The process to solicit feedback from stakeholders like patients, staff, and the community has been robust. And the feedback has not been mixed. It's been clear. SRHD is the best place for treatment services to be, with its wraparound support services and access to many other kinds of care. So I again urge you to listen to that feedback, retain treatment services within SRHD, and look for ways to make it even better. Thank you.
Thank you. Kashani.
Hi, my name is Kashani Hathatuagama. I'm a second-year medical student at the S. Floyd College of Medicine at WSU, and I've had the privilege of working with the street medicine team for the past year. Our number one priority is the health of our patients, many of whom face the devastating combination of substance use disorders and homelessness. Often their immediate need is survival. I have seen firsthand that with proper treatment, we can help patients regain control of their lives, move beyond survival, and start truly living again. While we may have different opinions on the best approach, I know we all share the same goal, which is to help these patients. For over 30 years, the SRHD's treatment services have provided care to thousands of patients, building trust with both the community and those they serve. In phase 1 of this study, community stakeholders have all expressed concerns that you will decrease patient quality of care and erode trust if we move to privatize. Why risk losing that trust when we could strengthen it? Why ask your community's opinion if you don't take it into account? Proponents of privatization have argued for removing this program from public responsibility, but doing so would harm the people we are trying to help. In the short term, we fear many patients would drop out of treatment as access becomes more difficult, less consistent, and potentially more costly. This would only exacerbate the challenges that they already face. The opioid crisis is one of the largest health emergencies of our time, and this program plays a critical role in addressing it. As a healthcare student, I believe it's vital to keep this program in the public sphere, where it can be accountable to the community and focus on patient care. We can't afford to lose this program. It's a lifeline for so many, and if we want to make a difference in this crisis, we need to build on what works, not tear it down. We owe it to our patients, to our community, and to ourselves to protect and strengthen these services for the future. Thank you.
Thank you. Okay, that's all I have signed up. Is there anybody else that came in? Okay. Yep. Come on up to the microphone and state your name. And actually, just before you leave, sign on.
Sorry, I'm late, everyone. Luis Manriquez. I'm a physician here in Spokane. So I wanted to, as someone who works on the street with people dealing with addiction every day, that I wanted to just leave a couple of notes on the situation as it currently stands. Recently, we have resuscitated people who have been on the street requiring multiple doses of Narcan, taking about 9.5 minutes to resuscitate them. We've also gone to the ICU and said goodbye to someone we've cared for years because no one was there fast enough to resuscitate them, and we had to remove life-saving measures. So the opioid crisis is ongoing and is concretely killing people in Spokane. I think it's important to recognize that as we continue this discussion about removing or privatizing some of those treatment services. And the reason I say removing or privatizing treatment services is because having more options for treatment services provides more opportunities to meet patients where they are at and address their needs specifically. In the same period that I was in the ICU saying goodbye to a patient that had overdosed, I was calling one of our private treatment centers to enroll another patient, and they told us that they were full, that they had a wait list, and that they probably wouldn't take up any new sign-ons for at least another month and a half. So at the same time that the crisis is raging, our capacity to address it is insufficient. And so in that context, continuing to have a conversation about privatizing a program that has worked for decades is just the wrong conversation to be having. So I'd ask you all to listen to the feedback you've already received from the community about this issue and stop this path so that we can focus on the things that are necessary to address the concrete and deadly pandemic that we're dealing with. Thank you.
Thank you. Okay. Well, now we will move on to board reports. So item number 4 on our agenda, so chair report. I will just touch base. We had our executive committee meeting a couple weeks ago, and that was really just setting everything up for today's meeting and making sure we were prepared as far as the agenda went. Commissioner CUNY, Finance Committee? It's probably one of your lighter ones after we adopted the budget. Or
well, no.
got it.
There was lots to talk about. So we went through the voucher review, looked at that, and feel that that's good. Went through our monthly financial report. We're good with that. Talked about a couple of contracts that are before us that the Gallagher Human Resources and Compensation Consulting contract and the Inside Source contract, and so those the Finance Committee is moving those forward. And then talked about the treatment services pro forma with Julie Shiflett, and so we had some information that will be coming forward from Dr. Thompson for us to talk about today.
Sounds great. Thank you. Councilman Cathcart.
No policy meeting this month.
Okay. All right. And we do have the legislative agenda queued up for an action item. Okay, that will bring us to our consent agenda, item number 5. Oh, and I'm sorry, before we go, I know Dr. Thompson just wanted to give some information. We have more than normal number of guests here, so
Yeah.
just wanted to, some housekeeping. I apologize.
That's okay. Well, we do have some guests that have never been here before, so I wanted to make sure that you knew where our restrooms were. They're just down the hall that you came in, and then if there's an emergency, you can go out either direction. So that's really all I wanted to make sure that everyone was aware of. Thank you.
Okay, item number 5 on our agenda is the consent agenda. These are our meeting minutes from October 31st, the vouchers for October, contract for Gallagher's Human Resources Compensation Consulting, and item 5D, a contract with Inside Source. Is there any items anyone would like to take separate or more information on before taking a vote? Otherwise, I'd be open for a motion.
Move to approve the consent agenda as presented.
Second.
All right, we have a motion and a second. Any comments, conversation? Seeing none, all in favor say aye.
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 Motion passes unanimously. That brings us to item number 6, which is an executive session, and I will look to Michelle Fossum to state the purpose and who she would like present and the length of the executive session. Okay, and it is 12:50, and so yes, if our guests could step out of the room, and then if we do need to extend, we will make an announcement outside the door, and then at the conclusion, you're all welcome to come back in. right, welcome back. We have concluded our executive session. We did extend for, we were in for a total of 30 minutes, extended for 20, and now we will, so for the record, it is 1:24, and we will now move on to our action items. And just for the record, there were no decisions made while in executive session. Action item number 7A is the election of the 2025 chair of the Board of Health. I am open to a motion.
I move to approve Commissioner Amber Waldriff to be the next chair of the Board of Health
I
for
will-
2025, sorry.
I will second.
We have a motion and a second to appoint Commissioner Amber Waldriff as the 2025 chair of the Board of Health. Any comments? Any other nominations? Seeing none, all in favor say aye.
Aye.
Aye. Motion passes unanimously. I will just do the next one, and then I will hand off the ceremonial gavel here. Vice Chair, are there any nominations for Vice Chair for 2025 Board of Health?
So I would move to approve Michael Cathcart, council member, for vice chair.
Second.
A motion and a second to appoint Michael Cathcart as chair, or vice chair of the Board of Health. Any other nominations, conversation?
Making sure it's not me.
Seeing none. All in favor say aye.
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 The motion passes unanimously. All right, I will hand over the gavel to the new chair, unless you'd like me to complete the meeting. Okay, do you want me? I can complete the meeting if you want. If you, there you are. Bang it once to make sure it still works. Okay, it does.
Well, thank you very much. I look forward to the next year and serving in the chair capacity, so I appreciate your leadership this year, Commissioner Kearns, so thanks for everything you've done. And you won't be going too far. You'll be right here. So, excellent. Thank you for your time as chair. We have next on our agenda 7C, which is Resolution 2412, adopting the 2025 Board of Health legislative agenda. Lola Phillips, I know you briefed us on this the last couple months, so why don't you tell us if there's anything new or updated, and look forward to this next year's session.
Sure. Thank you so much. There is a little bit of language updates. This is specifically, now I've got to look at the page here because I didn't. I was so enthralled with the elections. Congratulations. Okay. So there was just some improved languages for the page under policy and context rationale for increased support for youth and mental health and psychiatric services. So just some language improvements. These language improvements were shared with the board during the last meeting, but they were not incorporated into the draft that you see before you right now. And so the request of the board today is to adopt the draft as it stands with those updates.
Yes, Commissioner Kearns?
Lola, I noticed, I don't remember there being blank pages in the previous drafts. Is that intention? Was something not printed? Or, I don't know if everybody's, the third page is blank in mine. I don't know if that, maybe I just got one that was a misprint or something, or was there something missing?
Oh, it's because of the board packet and then the printing to ensure that the back cover.
Okay, so that there's not something missing here.
There is nothing missing.
Okay,
there.
okay.
No.
Just want to make sure.
Yeah.
Mr. Cathcart?
Yeah, I will make a motion to adopt the 2025 legislative agenda.
Second. We have a motion. sorry about that. Thank you. Oh no, was that not recorded? All those wonderful words I just said.
No.
Just give me a hard time. So I appreciate all the work. Thank you, Lola, and thank you to the Education Committee for your work on this and in making it a great document. And I know it'll be a living document, and I'm sure there'll be new things we need to focus on supporting and protecting in the session. So we look forward to that in the
Throughout
new year.
this long session, yeah. And also, just a reminder that there are extra copies in the back table. if anybody needs one. So thank you very much.
Thank you. All in favor of approving the resolution number 2412, adopting the 2025 Board of Health Legislative Agenda, say aye.
Aye.
Any opposed? Thank you. We've adopted that resolution unanimously. And we're moving on to 7D, which is Treatment Services Feasibility Study. Dr. Thompson.
Well, good afternoon, and thank you for giving me this opportunity to talk with you about the feasibility study. Since April of 2024, when I first asked the board to conduct the feasibility study, there have been multiple changes, and I've learned a lot about treatment services. I've attended 2 statewide DOH meetings and DOH and LHJ leadership meetings, one in April and one in November. And access to care was a focal point at both meetings. But in November, it became very clear that the state is looking at changing its stance on public health providing direct services. This is due to the need statewide to improve access to care, especially for preventive care. I have also learned there are quite a few business principles that can be applied to treatment services within the context of the health district that have not been applied before. And in order to incorporate some of those business principles, we would like to include them in our new electronic health record that is going to be rolling out, and that's going to require extensive work. And lastly, treatment services has returned to its normal status of being fiscally sound and will close the year with excess revenue. So in 2025, I would like to have the opportunity to implement what we have learned. We want to continue conversations with the State Department of Health regarding their support for direct services. We would like to conduct analyses to determine what efficiencies might be found in our patient flow, our patient access, and continue to work on team building. We would like to identify key performance indicators and build them into the new electronic health record so that we have dashboards where we can monitor our business metrics. We would like to implement our new process for developing policy, procedure, and tasks that truly clarifies processes so it's easy for employees to consistently follow and meet expectations. And lastly, we would like to focus on employee engagement and satisfaction. So therefore, I am recommending to the Board of Health that they table the treatment services feasibility study so that we can focus in on implementing the business efficiencies identified and to continue engaging with the State Department of Health regarding the provision of direct services. Questions?
Thank you, Dr. Thompson. Is there any questions from the board? Mr. Cathcart?
I'll second that.
Any discussion on the motion? Cuny?
So at the finance committee, the budget and finance committee meeting, we talked about this, and so I think in order to look at some of these indicators and get the information, I mean, I was willing to table for a little bit longer period because I think we may need some more time to really look at that. So I could see, having quarterly reports come back to us. There's, when you do an analysis of how to look at how we would look at transitioning or not, I think there's still just so many questions that have left, and I think we do want to make sure that we're providing the service that we need to. There was discussion during our meeting, do we table it indefinitely? And I don't think any of us want to table it indefinitely because we want to continue to have just the conversation in any business entity. You have those ongoing conversations as to how what's going on in that department, what's happening. This is a unique thing. One of the things we want to make sure is, as we talk about it being a business, it's still part of a government entity. And there's procedures and things that you can do in a private business that you cannot do in a government entity. And so I just want to make sure that, we're clear on that as well. So I'd be willing to table it for a longer period of time than just till, for a quarter. I think it's going to take a little bit more time for us to really develop what those metrics are, to know what our true business is doing, because we know we're serving clients, and that we know. But we still also have to look at the liability perspective, the other things that are happening, and really look at it, especially as they've moved over to the new building, that they're able to provide the funds they need to within themselves, that it's not the general fund of the health district that is funding those. And so I think I can see more time needed.
Okay.
Thank you. No, I appreciate that, and I'm certainly open to other timelines. My thought process was, and even thinking that March probably would not be the date, but just trying to keep it in front of us so that we're not losing sight of this issue and it's not kind of getting put on a back burner. So that was really my thought process for March. Open to other things, but I would like to keep it on the agenda as a monthly report so that we just get updates on progress or information or what's working, what's not, that sort of stuff on an ongoing basis, regardless of how far we defer consideration.
So in keeping with trying to satisfy both of what you're saying, my focus recently has really been on trying to refine the process and get more reports out of treatment services so that we can make better decisions and get some of the answers that we haven't been able to get when we're investigating all of the different moving parts. So I'm wondering if you would be willing to just modify your motion to maybe we could get on a schedule for a quarterly report with, I don't see anything wrong with monthly coming and saying kind of where we're headed with that, but if we could get a timeline where for the next year we're maybe going to be getting reports back from treatment services and from Dr. Thompson so that we can see how the things that you're talking about implementing are going, and if we have anything to contribute to that process and making it better. I just want to get a little bit away from the focus on people and all of the anxieties that are part of what we're trying to do, which is just do our due diligence and get more focused on the process and the things that are missing from our ability to do that to the best standard possible.
Might be cleaner to just vote this down and then a new motion.
So what I'm hearing is that you're suggesting, Ms. Kindholz, that we look at maybe, well, the motion was to defer a decision. I'm hearing the word table as well. So okay. 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 Any other discussion? Okay, so all those in favor of the motion made by Mr. Cathcart, say aye. Any opposed?
Nay.
Nay.
Okay, motion fails. So, do we have a new motion on the, I just wanted to speak to, I think there's some good ideas here. There's a lot up here that is new and interesting to me, like the state having conversations about direct services as part of public health. That's new information. I would like to explore that further. I don't think at the start of this process we knew as much about the business side of, and when I say that, I mean the day-to-day operations, how many customers, clients per counselor, and all of this stuff. We're learning a lot, which is great, because I think it's going to improve the work that OTP is doing, which is excellent and could even be better. So I just want to give Dr. Thompson the time she needs and her team needs to investigate, to support the program, implement the new electronic health record system, which I can imagine is going to take months. But I do think we need regular updates. So I'm supporting where the conversation is going, and I'm just trying to give you my feedback before there's any motion. Dr. Bykowski-May?
Yeah, thank you. I concur with a lot with everybody's ideas about taking some time to do this. What you're proposing there, just from my experience with a few different electronic health records, is that these kinds of infrastructure things, super important, but they take a while. So I think a year to evaluate that time. Certainly having regular reports is great, but just to put in that notion that these types of infrastructure changes are significant, they are great, they're the right thing to do, but it takes a while and some really strong commitment and collaboration to do that quickly. That's just my comment.
Ms. Commissioner.
Okay, I would like to make a motion, and if I'm headed in the wrong direction, don't second it, if you don't like it. So, I would move that we defer action on this agenda item to a date to be determined, and that we will have monthly updates as a part of your administrative officer reports and more thorough updates as a part of agenda items that will have an agenda placeholder on a quarterly basis. Trying to leave as much kind of flexibility there. Act at a future date. That could be short term, that could be long term. It's when we are ready and we have adequate information, and that'll be determined by a majority, but we will get those kind of shorter regular updates monthly, more in-depth on a quarterly basis, just so when we feel comfortable to make a final decision, we can do that. But I don't know when that's I don't think any of us know when that'll be, so. All right.
Discussion on the motion? Or Cathcart?
Yeah, I mean, I would probably prefer to put it on sooner, but I'm happy to support this. I think it's very reasonable, and at the end of the day, a majority is going to make this decision regardless. So I think it makes sense.
So just to clarify the motion, you're saying deferring a decision about moving forward to the next step of a feasibility study. Is that? Okay. My only concern, I think that I get where you're going. I think we're not ready to make any decision is what we're saying. We would like to, all of these things to start being supported, and it takes time and energy, and we don't want it to distract from the work that needs to happen at OTP. And yeah, again, as I said, the state, I'm interested in where the state's going with this idea of maybe because they're seeing public health playing a greater role. So it's interesting to explore that further, but who knows where that's going to go. I guess my only concern is for the patients and the staff and the management. What message are we sending? That this is something that we will consider in the future, but it's nothing imminent. I just am concerned about when we say we're deferring to time indefinite, what message that sends to, we've heard from community members that are concerned that, a decision's gonna be made tomorrow, which this motion says that's not gonna happen. So I just wanna, get conversation from the rest of the board about, is that the right way to make the motion, that we're deferring a decision until whenever? I just hope that still allows our treatment services and staff and clients to know that we support them, and we're investing in the work that they're doing, and that we're not just, this isn't hanging out there over people's heads.
Question. My question is for a parliamentarian, so I think that there's a difference between deferring and tabling, and that tabling is kind of removing the item. Deferring is saying we're going to come back to this later and make another decision. So I think from my standpoint, I felt like there was incomplete information for me to be able to make an appropriate decision, and that my preference would be, if this agenda item is going to be put back on the agenda at some point, that I would like to have the ability to look at everything completely, and this process can be improved in order for that to happen. Whether or not somebody raises it as an agenda item later is just forecasting to me. So I don't know whether the group is saying we want to keep this on the agenda, but we just want more information, or if the board is saying we would like to remove this off of the agenda, and then we will come back later and consider whether we want to put it back on the agenda.
Well, what I'm hearing from everyone is that treatment services moving forward as an action item is coming off of the agenda. There will be reports along the way, and then when we're ready, then it would go back on the agenda as an action item. That's what I'm hearing from the group. So that would be then tabling it.
That was the intent of my motion, because I think everybody at some point, we need to vote yes to go to step 2 or no to go to step 2. Just leaving something hanging out there by not taking an action, we haven't really we haven't done anything. So at some point, we will have to vote yes or no on going to stage 2. I don't know when that would be. That's why I'm saying at a future date. But that could be months, that could in theory be years, but I think at some point we need to have some finality to that question.
Councilmember Cathcart.
Yeah, to that point, I think that I don't have enough information, obviously, to vote yes to move to step 2 today, and that's certainly why tabling this or deferring it makes sense. But I also definitely do not have enough information to vote no. And so that's why I don't think this should either be be voted down or indefinitely, deferred. I appreciate the language that, we will determine a date and it will kind of still live. Because I think the whole point is we're going to develop a process and develop really good information, and at some point we will feel comfortable enough with either the trajectory of treatment services improving and things going great and the state coming in and supporting, or we've understood a number of information that suggests going a different route would be the improvement that we're looking for. And so we don't have that information now, and I think the point is we extend the process out until we have the information to go one way or the other.
Any other discussion? Commissioner Cuny?
Yeah, I mean, I think that's what, I agree. But I do want to, I'm not going to be ready, I don't think anytime soon. So I just want to put that out there, that this isn't going to be a decision that's going to happen in the next 3 months or 6 months. I think we've got to see how some of this plays out, and then we'll be, wanting to look in the future at which we don't know what that future date is. But I think we want people to know that we're, we want the safety of the clients that we have at treatment services. We want to get through some of these, areas. We do need to have that new system put in, which does take time to happen. And so, but I think it's important enough, and it's a big enough part of our budget that we need to be looking at it, at least on a quarterly basis, if not, I'm not sure if we're going to have monthly reports or if it's going to, quarterly is going to be the better way. So, that's the only piece that sometimes it's harder to, from a financial perspective, CPA here, that monthly, depending on what we're trying to look for on a monthly basis, I think quarterly could be a better way to really start to look at where we're at, what are the key performance indicators, and some of those can come back on a monthly basis as saying you've started this process with that. But I think it's just going to take us some time. So I'll be willing to vote in favor of the motion, knowing that it's a time that we need to take to really do this right.
Commissioner, Board Member Kindholz.
Thanks. Just to your point, I think that I hope that what they're working towards is getting to a place where monthly reports could be provided as part of what we get from finance every month. I think it might take a while to develop those reports, and so the process of doing that makes sense to me, that would come quarterly and we could get an update of this is where we are, and this is how we've improved this system, and hopefully monthly, so I'd like to see, preferably, I'd like to see something on paper at the quarter, and I would like to hear something verbally from Dr. Thompson every month, just a progress report that then leads into these are the documents that are being created as part of the reporting from treatment services. Does that make sense? And then maybe we can work something in there with cash flow and projections and income statements, and have a better concrete process there that we can then review, and will make it easier for us if we do get to the point where we are reconsidering this later.
Could I, before I go to you, Councilmember Cathcart, could you just read back the motion so I can hear the wording one more time? Thank you, Ann.
You're welcome. The motion is to defer action on the agenda item to a date to be determined, and have monthly updates as part of the administrative officer report and agenda report items on a quarterly basis.
Councilmember Cathcart.
Yeah, I was just going to ask either Lola or Dr. Thompson if we would be tracking the bills, and if that information will be shared out that might be related to more direct support from the state, if the legislature is taking that on. And so if we're bill tracking, it'd be great to share that and get those updates monthly as well.
Absolutely.
Dr. Velasquez, I had a question about the study, the asset map that you and I were talking about before the meeting here tonight, this afternoon. The Race Rundin Foundation, as I understand, has funded an analysis or an asset map of substance treatment and behavioral health resources in our area to try and understand how we can better align, serve during this opioid crisis. Do you know when some of that information will be available? Because I think that's also important information for us to have as a board, thinking in the future about our OTP program and how it plays into the greater fabric of resources in the community.
Sure, thank you for the question. So I think the data gathering will be completed by the end of this year, and the goal is to have the report out first quarter of next year, and I can get more detail since we're the third party advisory group, but working with the consultants. And just for folks that are not, may not be familiar, is actually we, the Spokane Regional Health District, we did a community assessment map of all services related to mental behavioral health, which includes substance use. Race Reading Foundation contracted with 3 Parents Consulting to actually take that to the next level and do effectiveness and coordination, as well as validating that all resources have been identified. So that will be a much more comprehensive perspective than what we have now. And that will be available to us at the district, yes.
I'm assuming that they will be they've interviewed or will interview folks in our OTP program to understand the clients we're serving, the number of clients, the services we provide. So that's going to be part of the overall data.
Yeah, correct. They had a very long list of community contacts, and I'll double check and make sure that everybody in our OTP that should have been included was included, since they control that interview process. But yeah, not a problem.
Thanks. I just wanted to bring that up because I think that will also help our whole community. And we heard a lot of good feedback from healthcare folks who are training for healthcare jobs and healthcare providers about the need for opioid treatment. And so it'll be good to know what are all the things that are out there. Are they accessible? How can we make them more accessible? And hopefully it will give us how do they coordinate between each other? Because I think what you were saying is that's probably what we're going to find, is that we have a lot of resources that's not always accessible and coordinated to those who might seek them. So, okay. Well, I'm going to comment that any other comments from board members on the wording? And if not, I guess we'll take a vote on the motion. Dr. Blikowski may.
Yes, I would second a friendly amendment to change the wording to table to the otherwise. I don't mind the wording, like the wording of the rest of the motion, and would just agree, just from my understanding of the words tabling and deferring. I also struggle with a deferring to, my understanding is you defer to something more specific, and that tabling would be the more appropriate word, and I think still gets at the intention that I hear from everyone on the board.
And I would just add that my internet research while we're sitting here would indicate that under Robert's rules, if you're going to defer, it's appropriate to defer to a particular date that's included in the motion. So.
Well, I think so. Yeah, and that was what I was trying to get to, because I think to table to a date undetermined is kind of what you're getting at, Commissioner Kearns. If we're not gonna do, if we're gonna do a date, then you would defer to a date, I think is the, and I don't know if we know what that date is, so that's why I wanted to bring up the wording. Councilmember Cathcart.
Yeah, I probably won't support a motion if it's specifically tabling. To me, that feels like we're essentially saying no, whereas deferring says we don't know yet. And so I would support a friendly amendment to say we won't take this back up until December of 25 or some date like that. But the motion to table it, I would not be supportive of that.
Well, I guess we can always make a motion. I don't know if the motion to defer to a date to be determined, I think would be a valid motion. It's just not probably normally used, so.
I do.
Okay.
So I've been a parliamentarian in the past, so there's a part of me that's going, but Dr. Blakowski did make a friendly motion. You didn't? I thought she did. A friendly amendment. Yes. Okay. Okay. Okay.
I think you'd be allowed to make a motion to amend. Right.
How would I go about, since the maker of the original motion, if I wanted to add a date to my original motion?
Yeah, I think you could withdraw the motion with the approval of the second and just make a new one, or you could move to amend your motion and then see if the second is still there. Might be cleanest to withdraw it and redo it though.
Okay. All right, well, I will withdraw my motion. Okay.
I will support withdrawing.
So I will make a new motion, being that I move to defer this item until the December 2025 meeting of the Board of Health. Also keeping in place, as Ann stated earlier, with monthly updates as a part of the administrative officer report, and then agenda items on a quarterly basis with a more updated, or with a more in-depth update on the treatment services feasibility study and implementation of the items that were presented as part of the PowerPoint.
Second?
Okay, so we have a new motion, and with a date identified as December 2025 with a second. Any discussion on the motion?
Was that just keeping the rest of the motion the same, except we added a date? Is that what you wanted to do? Yeah, okay.
Well, I would rather table and then bring it up if we have new information at a time when the information is available. I don't like putting a date on it because I do think these things are going to take a lot of time and effort, and I just feel like it still sends a message to the community that I don't know if it, I would like to put this item off the agenda, and then at a time in the future, if we have more information and we want to bring it back on the agenda, either staff asks us to bring it back on the agenda or a board member puts it back on the agenda. That's my preference, so that's why I'm speaking against the motion.
That's what my first motion would have done. So,
I know,
the
but then
second
we
motion was
had
because
some
everybody wanted a
Googling.
date.
We had some Googling around tabling versus deferring, and so I appreciate that you were being consistent with parliamentary procedure, but that I'm just speaking my concerns that it still keeps people in limbo for the next year. I don't think that that's what we want to do. But is there any more discussion on the new motion? Okay. Oh, Commissioner Cooney.
I guess I would just say, yeah, adding a date doesn't change any of that, I don't think. I think it just says we're going to bring it back up to have a discussion. You know, in the meantime, we're just getting reports. So it just means we as a board, which isn't a bad thing to be looking at things annually as to what programs are working or not working or any of that within any of the health district. We do that as part of our budget process. So I don't think it means that we're not committed to treatment services by putting a date. I think you requested a date if it was going to be deferred, so I will support the motion.
Any other comments? Okay. All those in favor of the motion say aye.
Aye.
Any opposed? Oh, did you?
I meant to say aye.
Okay, just checking. Okay, so the motion passes 5-1. And great, thanks everyone for having me be chair and have to do the parliamentary procedures, but we got through it. So I hope just for the record, I just feel like the staff even if in a year we say, oh, there's no need to remove treatment services, I just prefer to have us move forward, and then at a point when we, have proper information or new budget information, but I know we're going to get that from Dr. Thompson on a quarterly basis, so appreciate that, and good luck with the implementation of the new system. And I know it's going to make life easier once it's implemented for everybody working at OTP, and so I'm happy that we did make that decision to make that investment.
Thank you.
All right. Well, then we have our reports. Dr. Thompson?
Well, we're going to move into a really fun topic now. I love talking about kudos for our staff. And if you remember, we just bring 3 kudos per quarter before the board. And the peers vote on which 3. So the employees vote on which 3 kudos will come before you. So it is kind of a big thing because the list is fairly long. And so there are a lot more kudos because we do a lot of good work at SRHD. And so we're going to start with Haley Clausen and JC Bacon. They are amazing housing specialists who have already assisted 67 individuals and their families in finding or maintaining safe and secure housing in the first 6 months of this year. With their support, clients can enroll or maintain participation in medical care, adhere to treatment, and achieve healthier outcomes. Great job, Haley and JC. Thank you for all you do. Okay, next up is Joy. She has been a wonderful asset to the finance team and to the agency since she filled the long vacated position of receptionist 6 months ago. She is kind, patient, friendly, and has built a great rapport with staff and clients. She has gone above and beyond to learn about each program so she can better assist visitors and clients of SRHD. Next up is Jen Hansen. And Jen is so nice and positive in the office, and it creates a welcoming environment, especially on days when it's tougher to show up. And again, these are kudos that are submitted by our supervisors, our directors, our managers, and employees. So the fourth quarter kudos, we'll move on to those. And the first is for Keith Harris. And this individual would like to give kudos to Keith Harris. He is a DIS, Disease Investigation Specialist, with our STI prevention program. And Keith goes the extra mile continually with our clients, community partners, and coworkers. He is always willing to organize and lead outreach events. He meets clients where they are and helps them along their testing and treatment journey. One Tuesday night in September, Keith was at dinner with friends, and someone came into the restaurant and told the establishment that their friend had overdosed. Keith helped assist by calming the friend down and delivering Narcan, ultimately saving the friend. When emergency response arrived, the person was doing better. Keith updated them on his actions without skipping a beat. Kudos to Keith. Your community service mentality is amazing. Next up is a whole team of folks. We recently had a medical emergency event in the media area, and we might as well have been in public health emergency preparedness and response. This amazing group of people stayed calm and collected while reacting to their colleagues' emergency. They were quick and effective in caring for their coworker until EMS arrived. Each member had an immediate role in the response and did it perfectly. Please share a huge thank you to this emergency response team. Maddie, Jared, Brendan, very few people know Buzz's real name is Brendan, but it's Buzz. If you see him around, it's Buzz. Minton, Jackie Dunn, Amy Jennings, Kelly Hawkins, Brandon Hyde, and Ben Porter. And special thanks also to Tremaine Turntine for making sure EMS found us quickly without hesitation. Okay, and our maintenance team. This individual writes, I would like to acknowledge and thank the programs at the college location for their work to sort through inventory and identifying unneeded items in their basement storage spots. Further, I would like to thank the maintenance team for their removal, relocation, and consolidation of these items. It ultimately cleared several parking spaces down in the garage, as well as improved the safety of this area. So I just want to thank all who received kudos, including those who were not voted to be shared with you. But this is an example of just the wonderful things that all of our teams are doing in SRHD. And the next thing on my update is a strategic plan update. And so can I just run through real quick? Yeah, okay. I just wanted to make sure my brain had this all right. So this planning process has been amazing. It has been going so well. And the other day, one of the core team members mentioned that, you know, the way they're doing it, sometimes it's like, how will they ever get something like a strategic plan out of this process? And they come back with very clear information for our next work session. So these are the elements of the strategic plan that we are working on. These are examples of all the data that has been included in this process. And so, you know, we've been getting surveys from our staff and from all components of the community. Some of it was pre-existing, some of it, Village Reach has collected for us. And this particular picture is what I wanted to really talk about. What this picture represents is 140 employees going through the data walk at college, 20 individuals going through the data walk at the WIC offices. And, excuse me, it was 120 at college, 20 at WIC, and 20 from treatment services. And what I want to make sure the whole board is aware of is that this information just didn't go on a shelf. It has been actively used with the strategic planning core group to help us make decisions. And it's pretty exciting. This is the timeline. I'm just going to scooch right up to February of 2025. That's when we anticipate bringing the final draft before the board for approval. And we are on a good pace to meet that timeline. And then we had a second strategic planning session, and I basically wanted to share this slide with you so that you knew that this process is using theory of change to a strategic plan. So it is not willy-nilly. We are actually using theoretical underpinnings to our process. And it's just very exciting. I am so thankful that you approved the contract with Village Reach because they are doing a phenomenal job. Any questions? Okay, thank you.
I was just going to comment that Board Member Kineholtz and I are on the strategic planning team, and whew, it's been a lot of work. There's a lot of homework in between the meetings, and so this Village Reach consultant group is keeping us on track and moving us and helping us get through really tough conversations, because there's so many goals, there's so many things, you know, that we'd like to work on, right? But we have to prioritize, and so yeah, I actually put on my calendar for tomorrow morning homework because it's due tomorrow. So anyway, thank you, Dr. Thompson. And so then we have our financial report. Kim. Oh yes, sorry, Commissioner CUNY.
So I'm just gonna, it's kind of a long history, but the last time we did a strategic plan, it didn't come before the board until it was final. And I know the two of you are on it, but it still is good if there's a way to kind of inform the rest of the board along the way so we can provide some thoughts and input, especially a couple of us that have been on the board a long time, you know, just from some of the perspectives that we have. So I would just, you know, ask, because when I saw that there was a survey of the Board of Health, I'm like, I don't know that I got a survey, and if I did, you know, so if we all got that or not. So anyway, I just think if there's a way to just kind of, if you individually want to talk to us, you know, about what's happening and going on, just to, I would encourage you to do that, just so that way we can all make sure when it comes before us, we're well informed as a board for what that is, because otherwise, the last time we went through this, Michelle remembers, and you know, we had amendments to it at the board level. So So we just want to make sure that there's that, perspective for all of us. And I don't know how to ask the group
Right.
to do that.
So, is part of would it be possible, I'm just brainstorming here, because I understand and agree with you. It's hard when there's this planning team that has to be engaged in each, level, and, because it's an iterative process, but, is there an opportunity to give an overview of kind of where we started and where we have come to, like in January with the Village Reach team with the board?
So I have an idea.
Uh-huh.
And I'm going to look to Anne because we are going to have a special all-staff meeting. I can't remember the exact day of that special all-staff, but the purpose of that all-staff meeting is for Village Reach to present the where have we been and where are we heading. And then another survey is going to go out to all staff, allowing staff to provide feedback around where we are currently heading. And Anne, what is the date of that?
It's January 9th, and the staff forum is at 8:15 and it goes until 9. And it is also recorded, and I don't know, it may be possible to share that recording with members who were not able to view that.
What date is that, Commissioner?
It's a Thursday.
Okay. Yeah, I'm thinking if board members could be invited to attend if they wanted to attend, is it only virtual or is it in person as well?
It's only virtual.
Okay, so you could attend it virtually, and then it's recorded, so if that time didn't work on board members' schedules, they could watch it in the next few days and then fill out the survey and get a better sense of what the paths have been and where they're aligning, so to speak. Does that work for board members in January to have that opportunity? Because yeah, we don't want to just get it at the end like, here you go. We want an opportunity to see where the path is going, and then give input and be able to do that ahead of a final draft. So, and then what about the community? What about greater community input? Will there be an opportunity for partners and community members? Because we only chose a couple people to be from the community on the stakeholder group.
I'll talk to Erin about that.
I really do feel like it'd be important for our different community partners and clinics and communities who use a lot of our services, just to be able to get a sense of where we're going and be able to give some feedback before we have a final document. Because I know we have Ryan from Priority Spokane, and we have someone from Ada from
Better Health Together.
Better Health Together, and
Wilkie from
Chaz. Right. So we have some community partners, which is great, but I would think we'd want to touch base with a broader group of folks who really interact with our district and would want to give some input before a final document as well.
The only concern that I would have, and I'm looking to you, Dr. Velazquez, because our community health improvement plan is also going to be released, is that correct, in early January? And so my concern is the priorities and the goals identified in the community health improvement plan are very different from our internal organizational strategic plan. And so I do have some concern that there might be some confusion between those two. It's just a thought.
Yeah, I just think as a public agency, it's important that
Yes.
even though it's more internally focused, a lot of what we've been discussing has been about building trust with the community and strategies and also kind of outward facing communication, right?
Right.
So it'd be good to get input from folks on how they think we could do better at those things. Yes, Doctor.
Just a comment. So I requested the list of all community partners that we reach out for, which is very, very, very extensive. But if I understand correctly, the number of responses is relatively low compared to the all the people that we communicated with. So what I will suggest is we already have a built list of all the key stakeholders, all community partners. Maybe we can use that to do some very direct, like, okay, ask for their feedback, which they may not have provided when the original survey went out. Just knowing, and the reason why I ask is because the responses that I saw, my comment was, we have a very broad number and types of partners. And the responses that I've seen, I think, are very narrowly defined in some segments, which tells me we did not get feedback from all the other segments. But we do have the list. So if we work from that, it will be easy. My theory is that it will be easier if we specifically ask for feedback.
So we did do an initial survey to this large list.
That is correct.
Okay. And that was incorporated in the first meeting in terms of the consultant kind of consolidating all that information for us.
Yes.
Okay.
Commissioner Cuny, I just wanted to say that so far I've been very satisfied with the people that have been chosen and the input and the amount of time and just deep thinking that people are putting into the questions that are getting raised. And we're at a point now where we're kind of dividing off into special categories based on what, policy interested or whatever. So people who their expertise applies, they've separated us out into those groups and we're moving forward from there. We have a bunch of homework that we have to do by tomorrow, but anyway, so I just want to give you that reassurance that the quality of the people and the input that we're receiving from the group that is put together has been great.
Thank you. No, that's great. And it's great to know. I mean, it's great to have a couple of board members that are part of the process. And so, thank you, because I know it's extra work. So
Why did I raise my hand?
Yes, so appreciate it.
Well, and I think, so let's follow up on this question about could we send the video of the presentation and a survey link out to the same group? That's what I'm thinking. I'm not saying create more work, just if we have a group of community partners that we already sent it to, but I hear what you're saying, that some of our partners are very narrowly focused on opioid treatment or communicable disease or health permits for food handling, right? So we have people that are only interested in maybe certain portions of the work at the health district. So sometimes the feedback is not going to be as helpful for these broad goals and then the specific actions underneath. But anyway, I'll follow up with Dr. Thompson on that, and we can see if there's a way to get one more touch with, definitely with the board, and then with other community partners. Okay. All right. So there we go. Kim, please, what's our financial update? How are we doing?
We're doing well, thank you. Good afternoon. So this is the report that's in your packets for the month of October. So we're 83% of the year completed. We're coming in at 77% of expenses and 79% of revenue. We do have our complete Spokane County contribution for the year, so thank you, commissioners, for that. And then we also have some foundational public health services funding that comes in advance of the grant period. So that is why we are showing a surplus of $1.2 million at this time. I'm anticipating additional expenses in November and December where we start utilizing those funds. A couple notes of interest is our interest, actually. We had budgeted last year $300,000, and so far year to date we're at $434,000. So just a reflection of the interest rate increase that wasn't known at the time of the budget development. So we have an extra 134,000 year to date. I wanted to bring that to your attention. A little repetitive on the federal indirect and state grants. We bill those after the month end close, so those are not reflected here. And this brings us to unassigned reserves of almost 14 million, but at 25% of the overall budget. And total reserves are at 18.8 million. And that's really my October report, and we're wrapping up year end now and looking ahead to our 2025 budget, and I'll be reporting next year on that. Any questions with the financial report? Thank you.
Thank you. All right, Dr. Velasquez.
So good afternoon, everyone. And I have a number of quick updates on a number of issues that we've been tracking for the last few months. And then I would like to spend a couple minutes on two updates on activities from the health district. So we'll talk a little bit about some of the communicable diseases that we've been tracking. I'll show you a snapshot of our new respiratory illness dashboard, which is available to the community, and we're very proud of that. And then we'll talk about a couple of items on the public health and community collaborations. And I will go rather quickly through a lot of this because mainly for your information. All of the numbers are there, but please stop me if you have any questions at any point. So starting with pertussis, you know that we declared an outbreak about 2 weeks ago or so, and by now we have over 1,500 cases in the state of Washington, which is a significant number compared to what we usually see, which is in the 40s as a general rule. This is actually a graph representing the state of Washington. You can see how it's clustered in the recent past. So our clustering in Spokane County was very much, it mimics that, which is the reason for declaring an outbreak. So additional resources, additional information, and communication could be generated. I'm going to skip that one, but just show you the density. You can tell just by looking at the map that we are in one of the high density areas for transmission at this point in time. And if you were to look at the distribution by schools and others, it's pretty much everywhere. So the good news is we have not seen this concentrate in any subsegment of the community. So kind of good news, bad news, I guess. Meaning it's fairly heterogeneous throughout the population. And that is something that we had anticipated when we started to see the original distribution. This is when you look at all of the counties and by population, you can tell that we have some of the highest numbers. This is in Spokane County, and if you look at that curve and superimpose that bar graph with the state of Washington, it's almost like a mirror image, which makes sense. And what that tells us is our transmission is consistent with the transmission patterns that we were seeing in the rates in the rest of the state. We have a higher density of population. We also have a lot of children, which are more impacted, and we're a high education concentration region. So obviously we're going to see a little bit more than some of the other counties around us. This is the breakdown by age group. We had talked a little bit about before the concentration on the younger, particularly children, youth and young adults. Children typically are one of the high or predominant areas. We have not seen as many in the later youth individuals, others will call it elderly or seniors, but call it later youth, which are also at risk. And this just tells us on the graph, if you just look at the age groups, you can tell the spike that we saw in this youth and children and youth as was somewhat expected. Now, K through 12, kids are kids, so we see lots, and anecdotally, we've received reports of classrooms that have 30 students and 11 of them are out at the same time. Now, I do have to say thank you to our schools. They've been actively engaged with us, and lots of parents have received letters from the schools that they may have been exposed. We've also want to say thank you to our healthcare partners because the number of post-exposure prophylaxis that we've seen in the community has increased. And I not only hear that from our healthcare providers, from our team, but also we typically know those that don't have access to post-exposure prophylaxis. I can tell you the number of orders I have signed in the last couple of weeks is pretty high, which tells me people are being informed and we're doing the appropriate due diligence to making sure we capture any exposed members of the family. So I want to say thank you to both the schools and our healthcare partners. Now, in the recent past, we talked a lot about salmonella, and if you recall, this is actually the new alert that we just heard from produce coming from Mexico. This is a recent alert that came in the last few days, and this is actually the products that have been recalled. I do know that they were distributed fairly broadly throughout the country. All of them are pretty much out of the shelves. But if you happen to see one of those, let the establishment know. As far as I know, we have not really seen those remain in the shelves in Spokane, but it's important for consumers to be aware. And the FDA has made a point of having the pictures of the actual products, because when you talk about product and salmonella, a lot of people may not make the connection that we're talking about these bags over here, okay? So I think that's a good idea to actually show the product. This is not a criticism of the products, of course. We do think that the company is being proactive, and recalling is a really good practice, so we thank them for that. And as you can tell, fairly wide distribution. I hate this word because I can't pronounce it really well. Cucumbers. Thank you. That's why I don't eat them, because I cannot pronounce it. I just have an issue with that word. It's kind of a weird. Anyway, but we also had more recently an issue with organic eggs. That hits closer to home. It was actually in a Costco around the country. Again, great job, Costco, removing the eggs from the shelves. One of the things that I've noticed over the last, particularly the last, after we came out of COVID, there seems to be a very assertive stance from our manufacturers and providers on being alert and being on top of it and moving like very, very quickly. It's not like, oh, 6 months ago. It's like, yesterday we found this, so we're moving, which I think is actually great. Anyway, so I do have pictures of those. This is quite creative, but the expiration date of those is January the 5th. I know some people that took a walk through Costco and we did not see any of the eggs, so thank you to our Costco friends here. Now, we talked a little bit about this in the past, about the number of products that were involved in the listeria outbreak all over the country. There was a long, long list of products, like 147 of them. The good news is that is closed right now by the FDA. Any and all products have been retrieved, destroyed, et cetera, et cetera, et cetera, et cetera. The interesting thing is that with the E. coli outbreak that we saw secondary to the use of those chopped onions in the McDonald's quarter pounders, that is closed, but 2 days ago we just heard that there is another recall on broccoli, carrots, and other vegetables that is opening up the investigation again. So more to come on that. Just keep an eye on that because we'll be hearing about it more. So I put the slides together at the end of last week, so it just changed again. But these ones are closed. So we have a new one now. And again, it just shows that assertive stance, like let's move on and make sure that we're taking care of it. Now, this is something that the team, and you can go to the website and take a look at it, the team here worked very hard to put together, and the goal here is to give you a picture of all respiratory illnesses so we can track the trends, which is what's important for these illnesses any time of the year. And if you look over here, there are various areas you can look into. I just put the general one just to give you an idea. This just got updated a little bit before this week actually. But what it's telling us is that I lost this thing? Okay. We're kind of tracking compared to previous years. Maybe a little bit better on COVID right now, particularly when you look at ED visits. But we're getting close to the point of time in the year where the cold gets colder, we all go indoors and spend a lot more time inside. So hopefully we won't repeat some of the higher peaks we saw last year coming out of all the COVID precautions from previous years. So we're keeping track of that. This is active. You can go and click on any of the tabs. Has a lot of information. It's available to the public. And our goal is that it's not a mystery and everybody has it. Okay? So on the public health update, and Dr. Thompson mentioned the 2024-2025 Community Health Needs Assessment, which was just completed, will be released soon. This is a partnership between the Multicare Providence and SRHD, and the team from the data center will be at the January board meeting to give you an in-depth look into what this looks like. But I just want to give you high level, these are the top 3 priorities that were identified. Housing as an issue, not necessarily lack of housing, but cost of housing. Second, not a surprise here, which is substance use, continues to be an issue for our community. And not a surprise here, improve access and quality of mental health in the community. This statistics for youth and young adults, K through 12, continue to be worrisome in terms of mental and behavioral health issues. We did participate with the Spokane Public Schools on their Engage in Real Life program, which we're very supportive of. Part of it is trying to bring K through 12 students away from their 5 to 8 hours on the screen and actually participate in other activities to that decrease isolation and increase engagement, which is part of growing up. So, and I've talked to a lot of students. Actually, I was talking to some students today, and they're kind of excited. Example, I didn't know that board games are very popular again. So I would have never thought about that one. So, but anyway, this is a very important one. There was a press release today from the mayor's office about the homelessness dashboard. So the team at the data center specifically has been working very quietly, very diligently with all of our partners in the city administration, the county, and Spokane Valley. Because if you recall, way back when we said, we have this expertise within the Spokane Regional Health District, maybe we should be the repository for all this data. So I do want to say big kudos to the team for diligently working on that for quite some time. And thank you to all of our partners that are allowing us to aggregate and study and analyze the data. Yes, sir.
Yeah, how far back does the data go?
I'm going to show you a couple of pictures right now. So it is available in the County Health Insights right now. And this is version 1.0. So as you look at it, there are a lot of ways to look at the tabs. If there are any suggestions that you have for the team, we'll be looking for feedback over the next few months to see what do we do as version 2.0 is going to be updated quarterly because it's a lot of data. So let me show you a couple of things. First, if you go to County Health Insights, that's what you're going to see. That's a picture. And then once you go in, you can actually start to break down from 2023, 2024, all of the data that we have. And I'm not going to go into a lot of detail here, but I just want to show you the level of detail that is in each one of this in terms of who are we including, what are we including, what is the outcome of some of these individuals, do we know what the outcome is, and if so, what is the effectiveness up to a point. So for example, it's hard to see this, but these are the demographics, which is a breakdown of the community in many ways. And this is one of those interesting ones which tells you about people that have quote unquote exited from homelessness, where are they at? And one of the caveats that I want to, so Dr. Rodriguez and I were chatting outside before as we were on the break, and he actually pulled it up on his phone, so we were talking a little bit about, so what else can we be looking at? But one of the things I want to make sure that we're all clear on, that even if you're exiting, sometimes exiting means going to other institutions, doesn't necessarily mean that we've solved your house insecurity or homelessness issue completely. It means perhaps that you are somewhere else. And it could be everything from a shelter to a correctional facility, treatment center, et cetera, et cetera, et cetera, et cetera. So with this kind of detail, we'll be able to really start to figure out, so what else can we do where? Because one of the conversations that we've had multiple times is each individual is a universe. There's no one size fits all. So the more information that we have, the better we can start to aggregate and look at what can we do for specific segments of the population. So I just wanted to give you a really high level of that one because we're very proud of that work. And I'm going to go to Commissioner Cuny, who has a question.
So probably more of a statement because I have to give Dr. V the kudos for this because this was something that came to me, back in 2021, I think. And there was a nonprofit that was looking at putting together a database and what they wanted to do on homelessness. And I said, you need to talk to Dr. V because the health district can be that group that can do it through our data center. That we don't need to recreate and spend millions of dollars on a different system. And we do have the confidence and trust from the community in the system that the health district has, and then can keep the information meeting all the requirements that we need to with HIPAA or whatever would happen. And so I think it was back in 2020, it was during COVID, so it was a while ago that it's taken this long for this to happen, but I'm so excited to see it happen. And just thank you, Dr. V, for being willing to take those calls and help the community in this and your perseverance in getting this done. So thank you.
Well, thank you. But all the credit goes to the team. I just work with them. Yes, sir.
Yeah, I guess part of my question in terms of how far back we go, as a council member for the city of Spokane, I have struggled for 5 years to get access to data related to homelessness and continue to struggle to get access to data related to homelessness. And so just wanting to make sure that we're actually looking back at that data that has been collected. We have lots of provider-specific data, client-specific data going back years and years. And I want to make sure that we're looking at those as well as what's happening right in the immediate. I have some concerns from data that's been presented to us at the council that only looks back about 1 quarter, and I don't believe that it's giving an accurate assessment of the situation. And so I just kind of want to learn more about what sort of the end game goal of this is.
Okay, and that's a great question, and can't comment on what's being sent to the council because I have not seen it, but I can tell you that typically you take a baseline, which was this 2023, and then move forward to develop the dashboard. But our team is really good at doing retrospective and prospective and overlaying the two. So as we go forward, that's probably one of the areas that we need to focus on so we don't lose some of the information that is there. But the goal was to make sure that we could bring enough right now for it to be meaningful with what we have over the last, since 2023, 2024. But knowing the team and having seen what they can do, because they're really good at slicing and dicing data, from long periods of time. Now, one of the issues with longer periods of time is there's variables, but they're also really good at managing the variables that come with it because things change and resources change and there's a lot of population changes. But yeah, we're very excited about it. The team, again, has put a lot of time into it. And I just want to say thank you to all our partners that are trusting us with that. But the reality of the matter is that the team here does have the trust of the community. We're just here to do what is needed, and we don't take sides. This is the data, this is what it says, and then we just hope to act on it together. So anyway, so go and check it out, and you'll see a heck of a lot more than what I showed you. So.
Thank you, Doctor. I was actually going to ask you about it, and you already had it on your slides today, so thank you. At the Regional Homeless Roundtable in October, we were told that this was forthcoming, and the conversation was about look at what has been presented so far, and then the community will have a chance to give input to the staff here at the data center about, oh, what could we track this? Could this be a better indicator, right? So this was the first attempt at getting some data up there. I'm assuming pulling from the city's HMIS system, and it took a while to do all the protocols,
Correct.
to have that system be accessible by your staff. So now is an opportunity to look at it and then ask questions. And I think at our next meeting in the new year, we will have an opportunity to look at it and have people suggest, hey, what if we track this, or would this be a better indicator over time? So I think it'll be good for the city council as well. So,
Yep. Well, our goal is
and you know, the data is only as good as what's put in the HMIS system. So that's the other unknown, is if all the data put in there is always accurate. And that's, so I hope that this will help the city and their staff. If something looks weird, we better go back and see if that data was actually, you know, properly entered or collected correctly, because there's a lot of providers putting data into the city's HMIS system. So hopefully that'll just keep improving the quality of the data over time.
Yeah, thank you. Yeah, this is definitely the baseline. We'll go from here, and like I said, having seen the team work on a number of projects, I cannot even imagine how much more they can do with it. So, but it will be great. But here we are. It took a little bit of time, but it's on. So we move on to the next thing, I think. Questions?
Thank you for Commissioner Cuny for directing folks this way, because we have excellent people here, and it's just a question of time and capacity of the data center, I'm sure. Dr.
Yeah, and I just really wanted to acknowledge the powerhouse that we have at SRHD with our data scientists, our data analysts, our epidemiologists. We have such a solid, strong team that really works hard on behalf of many, many of our community partners. And so they do phenomenal work. I want to thank the board for your support of the data center throughout time. It's been wonderful to see that.
All right, any other questions for Dr. Velazquez? Commissioner.
Dr. V, can I ask, back on pertussis with whooping cough, when, I mean, I think it makes sense how children tend to get whooping cough, and whether it be a daycare setting or school. Is there any commonality amongst the adults? Are they teachers? Are they the parents of the kids? Is it the healthcare providers that are treating the kids that have whooping cough? Any commonality amongst the adult population?
So we haven't seen defined groups. We've seen a little bit of everything: teachers, healthcare, parents, families, relatives, neighbors. So we've seen a little bit of everything in the adults that we have, which is good, particularly healthcare, because we need to protect our healthcare. We have not seen a significant impact on healthcare, which is great. Good question. Yes, ma'am.
Patricia.
I don't think you mentioned the fentanyl roundtable, if you're still doing that, but one of the questions in the public input got me thinking about the number of overdose deaths, and I was curious about whether those are just fentanyl, like if we know whether they're fentanyl deaths or whether they're, you know, the stronger fentanyl family drugs. If do we have that separated out when somebody is overdosing? Do we know, is this because they took, you know, I don't know what the name is, I can't remember, the one that starts with a C, that's
Xylazine?
the stronger
Is that
one that's xylazine.
combined with xylazine?
Or is, is it, do we have data about that breaks it down as to whether the numbers of people that are coming in with overdoses or overdose deaths, are they separated by what type of fentanyl family drug they're using?
Okay. So, yeah, and the fentanyl roundtable is still going. The next meeting is the 19th. Where's Madison? I think it's the 19th, but don't quote me on that. And actually, Dr. Veena Singh, who's the chief medical examiner, is going to come to not this one, but the one in January, with precisely that data, her analysis of all of the substances that have been in the community. For the most part, right, we're still seeing a lot of fentanyl, but there's been a couple of other things that have surfaced, and she's going to bring all of that data to the January roundtable. Because it's important to know if there's anything else causing the impact. At this point in time, I think it's mostly fentanyl. Dr. Manriquez, I don't know if you have any thoughts on that too. That's what we've seen for the most part. Not to put you on the spot, but since you're here. Mm-hmm. Right. Correct. Yeah, and that is, so there's a degree of severity based on not only concentration but also the patient itself, because there are different levels. In xylazine, we have not seen what has been seen in other communities, which is some of the secondary effects of xylazine, such as the skin disorders and so on and so forth that we talked about a little bit, I don't know, a few months ago. But we will know better once we have all of that data in January, because the confirmed overdoses that are being looked at from a forensic perspective do go through all of the testing.
So if you wanted to just look up, and like you said, doctor, the medical examiner produces a regular updates, but also an annual report.
Right.
And so if you look that up, you can see last year's, and she has it broken out by, from her investigations when people pass away from an overdose, what was the likely drug. So she'll have new data. That the challenge with it is it's always trailing data, because she has to do her thorough investigation, and then you get that information, but not for months. So that's why I know there's been conversations in the community about tracking overdoses, so we know how many are happening, but you don't always know from what until you have that other information. But, oh, do you have? Right.
On the review.
Right. Yes, exactly. That would be great, but it's like getting all those agreements in place to make sure privacy is kept, and so thank you.
Sure. So for the for the sound perspective, because they couldn't hear, Kelly was talking about in the County Health Insight, you can also find our overdose data, and it doesn't have the specific drugs, but it does give you the trends and numbers and so on and so forth. And I'm sorry, the last thing was?
Well, we also have the Overdose Fatality Review Board.
Right.
But that right now has been looking at the 2023 deaths. And so they really dig into all of the medical records, the dental records, they dig into everything, and it's a very regulated process. But they will come out with their report too on their in-depth look at our overdose deaths. And so they'll begin their work on 2024 soon.
Thanks. So more detail to come. Thank you.
All right. Thank you.
Thank you.
Okay, so then we move to board member check-ins. And Commissioner Cuny, any check-in? Thank you. All right, Patricia, any updates?
Yeah, I'm sorry, Mary, I have a couple things I'll share. I went to the conference in Lola's Place for community leaders, and there were a couple takeaways that I thought people might find interesting. One was there was a book that's called The Anxious Generation that was mentioned. It's a 2024 book. I just saw it also mentioned on Bill Gates' recommendation of books, but it's about the generation of kids that have moved into being a cell phone generation and how that has affected their mental health. So I purchased that for myself, and my son was interested in it, and I bought it for my son and my daughter, so I thought people might be interested in that. There was an economist there, and he talked about narrative economics, and there was a book, Narrative Economics, that I picked up, and it was really about the way that these narratives that society has, don't match necessarily the science that is the economic reality, but also the way that that narrative manipulates the ultimate outcome. So I thought that was very interesting, and if you're an economics person, that might be a good thing to look at. And then another point that was interesting was there was a police officer there, or a law enforcement corrections officer with one of the jails in Washington, and he said that 70% of his jail inmates are there on trespassing. And I thought that that was just really important for all of us to realize when we're looking at these fentanyl problems, that when you're trying to address fentanyl distribution on the street and fentanyl administration to people on the street, that you really can't do a lot when you see those things going on. You, as a property owner, property manager, whatever, you can trespass those people, but you can't really say, oh, I saw them handing each other something and so on and so forth. So it really brings in a whole problem with regards to the jails and what we're doing to get a handle on some of the distribution of those things. And then my favorite there was the USDA rural development people, and I thought that that was nice to see them there and to learn some things about public health and rural development, and that's particularly something that I'm interested in, and that's it. Let's wrap up.
Thanks. I'm glad you're able to attend.
Yeah, it was fun.
That's
and
wonderful.
I got to see Mary briefly, but it was really nice, and it was a good conference.
All right. Well, I don't have any other updates. I look forward to sharing over the next year, and we'll try and get the meetings done more quickly, but there was a lot to talk about today, and I appreciate all the work for the staff and Anne to put together the agenda and work with us. So we'll see you in the new year. We are adjourned.